Hey, Team BCN. Happy Nurses Week to all of our outstanding nursing teammates. To celebrate the work that our nurses do each and every day, we're highlighting a few of these folks to talk to them about the work that they do to bring expert and compassionate care to our patients and families. In this conversation, we'll hear from Lori Norton, LPN on our transitions team, Jacki Hardyman, RN and Supervisor of Clinical Education, Suzanne Rineer, RN Case Manager and Certified Hospice and Palliative Care Nurse, as well as a Certified Wound Care Nurse, and Tonya Grubb, RN Case Manager for the Hospice Home Team. So now, let's listen to this conversation with a few of our nursing friends. Lori Norton, an LPN in transitions, joins the podcast today to tell us a little bit about her role as a transitions nurse. She's worked at BCN for a little over a year now and works as a transitions home coach to help patients stay well and prevent unnecessary readmissions to the hospital, and also enrolls patients at a partner hospital as well. Lori, welcome to the podcast.
Thank you for having me. I'm excited to do this.
Absolutely. This podcast is kind of giving us a little overview of the different types of nursing opportunities there are within BCN and just, some of the career opportunities and to highlight some of our nurses that we have here. So I really appreciate you joining us.
Yeah, thank you.
Yeah. How did you come to work at Bluegrass Care Navigators?
I actually worked for Bluegrass Care Navigators a couple of years ago. I was working full-time at UK, and they had a PRN position, and I was under Sandy Gowdy for transitions. And so I did that for a little bit, and then I actually kind of left the position. And so I was working for UK full-time, and I saw a open position for full-time at BCN. And I actually loved the work that I had done previously. And so when I saw the full-time position open, I jumped on it. I was kind of slightly nervous that I may not have gotten the position, but thankfully I did. So I switched from UK full time. I was there for 6 years and I came to BCN. So, like you said, I've been here a little over a year as a transitions home coach, and I actually really love what I'm doing.
I like hearing that you worked here. I guess it was like part-time, but that you loved it enough that you wanted to come full-time.
Yes.
Yeah.
Absolutely.
That's awesome. So tell me about your role as a transitions nurse. What does that look like?
So I do a couple of different things. I work with patients that are discharged from hospital to home. Some of them are actually discharged from hospital to subacute rehab. And the goal is, like you said, to keep readmission down. And so we go into the home or subacute rehab and actually educate them. A lot of patients are discharged and they give them paperwork and they have no idea what to do next. Even though they set some appointments up, they make referrals, they're discharged with new medications. Some of them may have wounds. So basically, we go in, we educate them on maybe new medications, educate them on wound care, educate them basically overall what happened with them in their visit. We may educate them on their disease processes, things of that nature, answer any questions that they may have about what's going on with them. We give them, or I do, give them my phone number to reach out if they have questions after their visits about questions that may be going on with them in between. We set up weekly visits to come see them, check in on them. It's kind of like a go-between, I like to say, between their physicians, things like that. We help get medication refills if they need it. Those referrals, we try to make sure that those appointments get set up for them. But I also work with dementia patients. And that program is a grant-funded program. And the goal of that program is to help find resources for long-term to keep those patients in their home, which is a really great program. Unfortunately, that program is ending in September, and I'm super sad about it. There's a lot of resources out there that people don't know about. And unfortunately, the downside to that is there's not a lot of resources out there for those types of patients too. You go in the home, you meet with families, you meet with patients, and you try to help set up anything that they can for long term to keep them there. And it's really important because those people, it's a little bit different than just going in the home and doing education. You're also doing education with them about that disease process, but it's totally different than the patients that are coming out of hospital. Their disease process is a little bit more advanced.
especially with the dementia patients that you're helping to provide care for. It's also a lot of education for their caregiver as well.
It is. Those types of patients, generally it's just the caregiver alone taking care of them. And so they feel kind of, stuck because they don't have anybody else to help take care of them. Now, that's not to say that the hospital patients aren't in the same boat, but you're finding resources for them too, and you're trying to meet immediate needs for them. And it's kind of the same in trying to meet immediate needs for those, caregivers with the dementia program. But also, you have to find something long term for them, which is a little bit more difficult.
You kind of serve as a knowledgeable liaison
Yes,
between their provider slash hospital and the patient and family to help them get what they need to have to thrive as well as they can.
absolutely. And then, like you said, you mentioned that I work in the hospital. I
Mhm.
do that a couple of days a week, and that is to enroll patients into both of those programs. So you have to do education with those patients as well, explaining both of those programs. So if you find a patient that would fit in the dementia program, you want to talk to those families or the patient if they're, coherent enough to understand. Or you want to enroll the patients in our transitions program. So you're doing education in the hospital as well.
I love that. And I can tell just by talking to you how passionate you are about what you do as a nurse. So, when did you know that nursing was the right career path for you?
Probably when I was 15.
Okay.
Yeah, I had a personal experience with hospice in my home. I had a loved one die, and hospice had come in to help take care of them. I've also had other experiences with hospice, over the years with various loved ones. But probably when I was 15, they came in, they took great care of our loved one in our home. And I saw like the compassion, the empathy. They helped not only take care of my loved one, but they were geared towards our family too, making sure that we were okay, making sure that the transition of our family member was smooth. But like I said, they were geared towards our family and making sure that we were also being taken care of. But that compassion, that empathy made me think this is something that I want to do. Like I want to help people. I want to be a part of people's lives and knowing that I'm making a difference because they made a difference in my life. So, yeah, that's where it started. I will say that I did go to school for teaching. Um,
Well, you're educating people.
yes, throughout that program, but I already had my LPN degree,
Okay.
um, and so I went through that program, and I was a year away from graduating with a teaching degree, and I decided I don't really want to do this. I want to teach, but I don't want to teach younger kids. I, I think my goal was I wanted to teach nursing to adults, and this is a great way to be able to do that um,
Yeah.
with the job that I have. So
Yeah.
I
It
went
sounds
back
like
to nursing. Yeah,
yeah, it sounds like you found your niche.
yeah, absolutely.
Yeah. I have one question that I ask everybody who comes on the podcast, but before I do, is there
Uh-huh.
anything else you'd like to say that we haven't already talked about?
No, I think that I'm just really grateful to be in the position that I'm in.
Yeah, it sounds like it's a great fit for you. So
Absolutely.
happy to
Yeah.
hear that. So, because this podcast is about getting to know our teammates a little bit better, what is something that others may not know about you?
I have two boys. Some people do know this, like close coworkers. I have
Yeah.
two boys. One is 24, who is married. One is 16, who just got his permit. So we're
Wow.
driving. We're driving all over the place.
Uh huh.
I've been married a little over a year. I got married October 22nd of last year. And I have two stepkids. One is 18 and he's in college at Georgetown. And little girl is 9. And so life is good right now.
And I believe you told me you're thinking about going back to school for
I
your
am.
RN degree.
Yeah, absolutely. So I enrolled in BCTCS and I am going to apply for the spring semester, but I'm also looking at some programs possibly online so that I can work full time and go back to school. So,
That's awesome. What
yeah,
made you want to pursue further education?
I think I want to absorb all the knowledge that I can to help my patients sometimes I feel like as an LPN, I have like limited knowledge, even though I graduated in 2005, which was ages ago, and I've worked as an LPN for that long. I feel like I still have more to gain, more to learn. And I feel like that would benefit my patients even more. So, going back to school and learning all the things that I don't know can only benefit me, them, benefit me with work. So I decided it's never too late. I know that I'm going to be an older student, and that kind of makes me nervous, but I'm super excited about it.
I love I love learning, and I admire you for wanting to pursue this next step. So
Thank you. I appreciate that.
yeah. Well, Lori, this has been a great conversation. I know it's been short, but I've really enjoyed getting to know you a little bit and
Thank you.
learning about what you do. So thank you very much.
I appreciate it.
Jacki Hardyman, RN and Supervisor of Clinical Education, has worked at Bluegrass Care Navigators for 15 years and joins the podcast today to tell us a little bit about her role as a nurse here. Jacki, thanks for joining us.
Thanks for having me.
Absolutely. So, how did you come to work at Bluegrass Care Navigators?
Well, several years ago, 15 years ago exactly, I was inspired by a friend of mine who was working with me in acute care to come work in a PRN role at Bluegrass. And after just being here a couple of short weeks and working with my preceptor, I realized that hospice care is where I was meant to be. And so I've been here ever since.
Yeah. How did you know that hospice was right for you? Because it's completely different than any other nursing area.
It really is. And I think what engaged me the most was my ability to slow down and really get to know my patients and develop relationships with patients and families. And, we do that over time here at hospice. And it really was nice to kind of come full circle with the care that you provided and be able to really see the difference. I was really motivated by being able to make an impact with the patients and families that we serve. And, you know, the contrast to that in acute care is that you have a lot of turnover in a really short period of time. And where I found it to be most rewarding was having that extra time with our patients and families.
What has your career path been like at Bluegrass Care Navigators?
Well, I've actually been able to serve in several different capacities here at BCN. My home office when I started was the Northern Kentucky office, and I've worked as a case manager. I have been in an on-call position there. I also worked as a long-term care coordinator for a little while. And all of those positions really positioned me well to move over to professional development when our organization created that department. I had a lot of different experience working across our hospice service line. And so about 5 years ago, I decided to become a clinical educator, working in professional development, and have moved up in this department to now I am the supervisor of clinical education.
That's
So
really
I'm
awesome.
really
Yeah.
enjoying that.
Yeah. Tell me about your role as supervisor of clinical education and what you and your department does for the rest of the team.
So, professional development is responsible for exactly what that says. So, developing our professional staff. So, whether that is our staff that is existing or if it's new employees that are coming into the organization, we support and I support all of our service lines. So, it's not just hospice, but all of the service lines that require assistance for developing their staff. My specific role, I have 3 clinical educators that report to me, and so I support them. And I am also responsible for supporting our leadership. I serve on several committees. I try to do my best at giving advice and input as we have changes across the organization and how that can be then relayed to our staff and trained. I develop our training material for onboarding and for training our staff. It changes daily, kind of our requirements and kind of expectations. We have to adjust often to what we do to be able to meet the needs of our staff and the constant changes that we're seeing that occur in
Right.
healthcare. So
Yeah.
it's a pretty exciting position, actually. And I enjoy getting to work with so many people across the organization.
Yeah. Yeah. What I see and what you're telling me is that as a nurse, you were helping patients, right? And you have moved on to help the people who help the patients. Do you think that's a fair assessment or no?
No, I think you're exactly right.
Yeah. Yeah. I just think that's cool that once you found your niche, like you just kind of leaned into that and kept doing things that you found really interesting.
Yeah. And I can't imagine really doing anything else. I have furthered my career working or not my career, my education working for BCN. And it's been such a supportive organization. And I love the culture where we are. And it really does fit me well. I do enjoy it a lot.
Yeah, yeah, absolutely. So, because this podcast is about getting to know our teammates, what is something that others may not know about you?
I love to travel. I have been to several different countries. I like to be active. I like to ski. I have a little side business where I craft and create t-shirts and tumblers. That's something probably most people don't know about me.
That's awesome.
Yeah, and I have a new grandbaby. So lots going on in my life.
Oh, wow. You are a busy lady, a busy lady. So, thanks so much for taking the time to talk to me and to share with our team. So, I appreciate your time and what you do every day.
Thank you for having me.
Suzanne Rineer, RN case manager and certified hospice and palliative care nurse, as well as a certified wound care nurse in our Northern Kentucky office, has worked at Bluegrass Care Navigators for almost 5 years, and she joins us today to tell us a little bit more about her role at Bluegrass Care Navigators. Suzanne, welcome.
Thank you. Happy to be here.
Absolutely. So happy to get to talk to you today. So, how did you come to work at Bluegrass Care Navigators?
So 5 years ago, my son, who graduated from medical school, he applied up here to Children's to do his residency. And we all kind of moved up here together. So we were new to Northern Kentucky. And I really, really wanted to do hospice work. I had been an oncology nurse before and researched the hospice groups up here in Northern Kentucky and decided that I really, really wanted to work for Bluegrass. And I prayed about it and I got an interview and then they got the job. And I'm really happy that I did.
That's awesome. How did you obviously, you worked as a nurse for a long time. How did you know that hospice was the right next fit for you?
I worked as a missionary in Africa for 25 years and I saw a lot of suffering, a lot of things that made my heart very, very sad, and really wanted to get into the medical career to just be able to help people more. When we came home from Africa in 2009, and it was apparent we couldn't go back, I went to nursing school with the thought that I really wanted to do hospice. The idea of having someone be able to die in their home with dignity and having the ability to ease their suffering and empower the families to help them was so intriguing to me. They could die at home and not be hooked up to all kinds of tubes and wires and machines and be surrounded by loved ones. And that is something that propelled me to go to nursing school. And then the dream of actually being a hospice nurse was realized when we moved up here.
That's awesome. That's a really cool story. I mean, because you went to nursing school relatively recently then.
Yes, I went in my 40s. It was a second career for me. My husband got sick, and it was apparent that I had to have some kind of ability to have an income. And I thought, well, I'll start as a CNA, which I did. And then I went to nursing school, and my family was super supportive, even though it costs a lot to sacrifice the time and money and, for mommy to be in school. But we have 6 children and they all were super supportive. And so, yeah, and then that's where I find myself today. I'm
Yeah.
still very, very fulfilled in this career.
That's awesome. That's awesome. I'm glad you found a good fit. And I think your story's really interesting because a lot of nurses I've talked to, they know nursing to begin with, but you kind of knew nursing and hospice were going to go together for you. Is that?
Right.
Yeah.
Yeah, I think because of my experience in Africa, the idea of institutionalized care versus having somebody in their comfort of their own home was such a value to me because of what I witnessed there. And bringing that here has only reinforced it over and over again in the lives of my patients that I deal with every day.
Absolutely. So, as I read at the beginning, you're a certified hospice and palliative care nurse, as well as a certified wound care nurse. And I believe you told me before we started recording that you also are a preceptor. So, you do many things. Tell me a little bit more about your role on the hospice team.
I am a case manager to a team, so I have a team of patients. And what I love most about that is empowering these families to care for their loved one at home. Like I said,
Mhm.
that's really exciting to me. And then precepting the people who are coming in, the new hires, to make them love this job as much as I do. It's exciting to
Yes.
me. And then I do wound care too. I have consults from the nurses if they have a patient who's really suffering with a wound. End of life wound care is difficult, and we really seek to palliate those wounds and ease the suffering caused by them. So that's exciting to me too. Just feeling every day when I shut down my computer that I've done some good, that I've eased someone's suffering in the day is super rewarding to me.
Yeah. What does a day usually look like for you?
Well, I visit my patients and of course all that, the families and the patients in their homes or in a facility. And then I'm available to the nurses too if they have a wound care that they want consulted on. They email me, and we usually connect by phone. Or if I have somebody with me who's new to hospice and is precepting, she would just shadow me all day, and we talk about what they need to know to do a good job.
Mhm.
And that's about it.
Yeah. I think that's awesome that you're a preceptor because I was talking to Danielle Root, our nursing resource officer for another podcast, and she was talking about how it was said in the 90s when she was coming into healthcare that nurses eat their young. And so I think it's really great that we are changing that and like helping our new nurses become acclimated and be the best that they can be.
Yeah, oh yeah, of course, because it directly impacts patient care. You can succeed in a job when you know you do it well and you know how to do it and you're not overwhelmed. And I
Mhm.
think that's important that we teach the people coming in to this job. You've got a whole team behind you and you got a lot of support, and it's going to be okay.
Mhm. Absolutely. Absolutely. Is there anything else you'd like to mention that we haven't already talked about?
I'm just very, very grateful for this organization. I really, really appreciate all the support from HR down to my local office. People have championed for me in various situations in my personal life and in my work career. I mean, they paid for my chip-in exam. That has empowered me to be a better nurse. They paid for my wound care exam and the course that I took because I wanted to do those things, and they allowed that. I'm just very grateful to work for this wonderful company. And
Yeah,
no one's
it's real.
paying me to say that.
No, this is not a paid advertisement, but it is really
No.
great to work not just with people who support you, but with an entire company that supports you and wants to improve you personally and professionally.
Yes.
Yeah, definitely. So, because this podcast is about getting to know our teammates a little bit better, what is something that others may not know about you?
I've had an extraordinary life, and I've lived in probably 5 different countries.
Oh, wow. Where have you lived?
Canada, US. We have lived in at least 2 countries in Africa, and I visited other countries, South America and Europe. So, yeah, the world is a big place and yet very small.
Yeah, that's awesome. That's awesome. Well, Suzanne, thank you so much for the work that you do for your team and our patients every single day. We appreciate you so very much.
Thanks, Heidi, for letting me talk today. I appreciate you asking me.
Absolutely. It was my pleasure. So, Tonya Grubb has worked at Bluegrass Care Navigators for 5 years as a case manager for our hospice home team. And today we'll learn a little bit about who she is and what she does in our Hazard Regional Office. So, Tonya, welcome to the podcast.
Thank you. I'm happy to be here.
I'm so glad to have you. So, how did you come to work at Bluegrass Care Navigators?
I had worked at Pikeville Medical Center actually as a shift supervisor on the cardiac floor for about 5 years before I came to hospice. But we did have some patients that ended up being hospice patients on our floor that were there for more than our usual patient, a little bit longer than our usual patients. And I felt like it was more for me, like the compassionate type of care that you deal with hospice patients. And then I had a good friend that worked for hospice, so she kind of encouraged me to make the change. So,
Yeah. Yeah. And you've been here, you said before we started recording, the end of July would make 5 years now.
yes, that's correct.
Yep. Yeah. So, when did you first know that nursing was right for you?
I actually did bookkeeping before I went back to nursing school. So I had a friend that had been a nurse for a few years. She was my best friend, and she just kind of talked me into going into the field. And then I ended up like really loving it.
Hmm.
So that's kind of what got me into that.
Yeah. It sounds like you have really good friends because a friend kind of saw your gifting for nursing, and then another friend helped you kind of find your niche with hospice.
Yes, yes, I have several friends that were in nursing. They kind of brought me to nursing and then brought me to hospice. So yeah, you're exactly right.
Yeah. So, what about hospice? Because it's a completely different field than cardiac. What about hospice kind of drew you?
Just the compassionate kind of care. In hospice, I feel like we build more of a deeper relationship with our patients and their families through some of the hardest times in their lives. We provide comfort and peace for patients and families in need. So I felt like that was more for me than like when I worked on cardiac, we didn't get very much time with our patients or families. I mean, a day, 2 days, maybe, usually at the longest. So you didn't really get to develop a relationship with them.
That makes a lot of sense. Yeah. So, tell me a little bit about what you do as a case manager for the hospice home team.
So, as a case manager, we completely manage care for our patient. Like, if our patients need labs, we draw labs. We go out to the homes once a week to do a full assessment. And then, if they need anything, of course, we're available 24/7. But if we get in the home and the patient's having symptoms, we contact the nurse practitioner or the physician to get new orders to try to manage patient symptoms at home. And then we have a good relationship like with our social workers and our chaplains, and so I let them know if there's any patient needs. They go out once a month generally, but a lot of times it's more than that.
Yeah. Yeah. So, you're the connector to the holistic care that Bluegrass Care Navigators provides. Is that a fair assessment?
Yes, yes, I would
Yeah.
say
Yeah.
perfect.
Yeah, that's awesome. That's awesome. So, because this podcast is about getting to know our teammates, what is something that others may not know about you, Tonya?
I am currently 33 weeks pregnant with a new little boy, and I have three other children, and then I have five Great Danes.
Oh, wow.
And
Wow,
then
you have,
yeah, I have a very busy life.
yeah, you do.
and
Yeah.
and so we also do foster care. So I have three foster children living in my home as well. So
Oh, my goodness. So, you have a total of 6 children, one on the way, and 5 human-sized dogs.
yes, but this those dogs do live outside. They have a massive dog house. So a lot of people keep Great Danes inside, but we couldn't do that. So uh,
Yeah.
But yeah, we love animals. We also have pigs and goats and sheep.
Oh my goodness, that's so cool. So you have a farm.
Basically, yes.
That's awesome. That's awesome, Tonya. I love that. So thank you so much for hopping on today and taking the time to share. And happy Nurses Week.
Thank you very much. All right. Well, I will talk to you later.
All right, Tonya. Thank you so much. I really do appreciate your time.